May the 1st of 2021 is Doctors' Day in Ontario, and heads of councils, mayors across the province have been asked to participate in a program and shine the light for them, specifically physicians in our area. And one of the ideas was to highlight a physician in your community. Welcome. So, David, thank you for joining me today.
Well, thanks a lot, Sandy. It's great to have this opportunity. I've been in Orangeville since 1984 and had a wonderful career here, which is continuing, as you point out now. And I'm happy to try and give you a flavor of what my experience has been like.
Right. So, if we could track back to 1984, I think I saw on your bio, you graduated from the University of Toronto in 83. Is that correct?
Yeah,
So
that's
you,
right. And then I did a one-year internship at the East General and had a really great experience there. And then came to Orangeville. I did go to Collingwood and did some locums for a couple of weeks. But as I was saying, when I came and met Dr. David Scott and had an interview with him and Dr. Gary Veenman, who was then in charge of the emergency department, I immediately knew I'd found my home. David showed very obvious leadership, characteristics of a physician who could make things happen in a community to ensure a good provision of care throughout the community. I was not disappointed. Within a year of being here, I was working in the Emerge, delivering babies at the hospital and running my practice nearby. I always say I had a triangle. I lived in a house near the hospital, and between my office and the hospital, my house was a nice little triangle, which I could walk in a few minutes.
right.
And I had immediate confirmation of what a great community of physicians there was, with tremendous collegiality, hard work, and some of the formative physicians involved and that were mentoring me was Dr. Gord Willens, Dr. Bob Apps, Dr. David Scott, and Dr. Gary Veenman, and a lot of the senior physicians here were tremendous experience and tremendous caring for patients. And after growing up in Toronto, I realized that after being here for 5 years, that the people of the Orangeville received medical care that was probably more connected, i.e. the physicians were so connected to the community and they were so caring that the patients just got excellent care. And we took advantage of all the services in Toronto when necessary. And I always felt that we used them really appropriately. And in fact, I can regale you with stories of getting kudos from people at Sunnybrook, St. Mike's for the care we provided to patients. And I always come back to the leaders that we had at those times. And that leadership has continued today. I could talk about the physicians that we have in our community today that are continuing to provide that leadership. I always say it's like getting a ball rolling, and the ball has been rolling in a good direction basically for my entire career here, and it continues to roll that way.
Very good. So when you, I guess in any work environment, it's very fulfilling to have supportive colleagues. And you'd mentioned that your colleagues sort of build each other up rather than try and knock them down, and that had, has happened in other communities. So that continues today, that everybody's really supportive.
Absolutely. In fact, you make me think of one colleague I recently worked with. It was about maybe a year ago on a rather challenging case in the hospital, and that was Dr. Atul Joshi, who's an internist here. Mm-hmm. And working with him, and I know it was mutual, was just such a pleasure in terms of trying to use all the resources we could, both in our own town and then accessing specialists outside the town to establish the diagnosis so that this patient could get proper treatment. And it was kind of funny because we were standing in the nursing station and we both thought of it like almost instantly because we were talking, and then it just both came to us what the issue was. And so he made some more phone calls, and sure enough, we got the patient down and had them properly looked after. So that kind of experience is not unusual during my career, working closely with physicians, coming sometimes because it takes a whole cast of people to make a difference. And as we talked about before, Sandy, how important all the other healthcare providers are all in this. And just as same as the physicians, I find the nurses work well together, both with other healthcare providers and among themselves. And we really are lucky to have the quality of care we provide at our hospitals. You know, the healthcare system, just like any other system, is not perfect. But my experience of being in other communities is that I really feel that we do the very best we can here.
Right. I just, we're sort of still in the middle of, unfortunately, this pandemic, COVID-19 pandemic. And, our particular health unit, the Wellington Dufferin Guelph Health Unit, I think has done a particularly good job under the leadership of Dr. Nicola Mercer.
Right.
I know Dr. Mercer was actually criticized pretty harshly. I believe she was the first one to impose a mandatory mask order here in commercial settings. And yet, she was leading the flock, so to speak, in Ontario by making that order. So kudos to her. But we also see that how fragile the healthcare system is when something like this can happen. Where the worry initially in the pandemic was the overrunning of the healthcare system, and specifically intensive care unit space and such. But we managed to hold it together here, and I think the support staff that you talked about, whether it's PSWs or nurses or the physicians and all the other, even the cleaning staff, I mean, they had to up their game during this as well. So there's a really, running the hospital is, it's sort of a living, breathing entity, isn't it? I mean, with all its parts, and yeah. So
yeah, very, very, very true. And then, we have a family health team here in Orangeville that's made up of a number of parts, the Orangeville Family Medical Center, and then Highlands Group, and also collegial work very well together, have a common goal of, again, providing the best family medicine that they can, and really, really, really great groups. I feel very lucky to be in this community and work with such dedicated people. And again, that's all providers. Yeah.
Yeah. I even think about Dufferin County. They run our paramedic program here. I know you've met Tom Reed many times.
Oh, yeah.
Paramedic program. I think, from all reports, they do an excellent job as well. They were also part of the setup of the COVID testing center at Headwaters early on in Dufferin County in the town of Orangeville. When the tough get going, when the going gets tough, the tough get going, and all of the senior managers at every level in this area got together to make sure the directions of the public health authorities were followed. And we, although we did have a few hot spots here in Dufferin County, for the most part, people have remained safe. Those who are listening to the protocols of hand washing and masking and physical distancing are staying safe. So it's been a good thing here in our area. So I just wanted to ask you again about the history of you getting into medicine. What drove you to decide that this was a career path for you?
Well, it really is a calling. I think whether you're a physician or a nurse, it's obviously for people that want to provide help to other people, but medicine also requires, as I said, because I teach a lot of residents. I've taught a lot of residents over my years from the University of Toronto. And as a physician, you have to like disease, which sounds like a very strange thing, but it's true because that's what you're facing every day. And you have to have an interest in it, a curiosity. And so that really makes it a calling. And for whatever reason, I had that interest. I remember when I was at Mount Sinai, learning from Dr. Michael Gordon, who also was a tremendous mentor for me. he eventually became the head of Mount Sinai and then went on to look after Baycrest for years. And I remember the first patient I ever saw, a patient with rheumatoid arthritis that was in hospital at Mount Sinai. And, when I had applied to medical school and got in, I thought I knew why I wanted to do it. But when I sat with that patient for the very first time, it was like this excitement and fascination and interest. And I've never forgotten that I recognized that the reasons I thought I wanted to be a physician were just fine, but then I found out that I was really in the right work. And I remember when I finished with Dr. Michael Gordon after the year I was there, and he had recognized that as well. And he said, that's what's going to make you a physician, is that interest in illness. It kind of sounds morbid, but the reality is that if you don't like that, it's going to be hard to do the work of a physician, especially on front line, if you're going to be dealing with illness.
It seems to me, listening to you today, there's also this investigative side to medicine. You mentioned, is it Dr. Joshi that you were working with? And the two of you sort of had this aha moment together.
It was true detective work, that case, because it was we actually had, anyway, I won't go on all the details of it, because that could in theory reveal who it is. And it's a long time ago now anyway, but it's true that detective work is part of it. And recognition, pattern recognition, and those sorts of
problem
things.
Solving.
Problem solving, and problem solving too.
And putting the correct decision making on therapy or whatever pharmaceuticals you're going to add to the mix there to create the solution to the problem.
Patients often will come in, when they're worried and have a problem and ask, well, can we try this treatment? And I said, well, first of all, we got to decide what the problem is. It's like taking your car into the garage and saying, well, just replace my carburetor. And the mechanic's going to say, well, I have to find out what's wrong with the car first. And it's the same idea. You have to put that work in to make sure you have a diagnosis that is really confirmed. And then it's not necessarily easy, but where you go from there in terms of treatment.
Right.
And
well, I wanted to,
our community, I was mentored in that. I learned it in medical school, learned it in my internship. And then when I came here, it was pervasive, that kind of thinking. And I had been in another community before I came here where I just didn't get the same sort of really pervasive desire to, among almost all the physicians, to provide good care in this way.
Right. Well, I think we're all extremely fortunate to be living in this beautiful country at this particular time in the history of the world when, medical treatments have really advanced tremendously, even in our lifetime, David. And you've experienced and been part of it. And we're so very fortunate. And to be in this community, again, of caring physicians, yourself included. I don't know when the first time I saw you, but likely 25 years ago or so. Yes. And having a physician who's got a friendly manner about them and solves your issues for you or helps you solve your issues is very much appreciated. And I wanted to thank you on behalf of the entire community here in Orangeville for what you do, and all of your colleagues that have continued and will continue in the future to provide excellent medical treatment and service to the community here in Orangeville. So I want to thank you. We've been talking for 20 minutes or so. Really appreciate your time today. Again, the Ontario Medical Association Doctors' Day in Ontario is on May the 1st. They're suggesting at 9 p.m. on May the 1st, everybody turn their lights on in salute to our medical community. Turn your phone light on, turn your lights on your house on, and salute everybody. And they're using the hashtag Shine a Light for them. So, David Knox, thank you so much for joining me, and all the best.